Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Steve Daly. It's Thursday, October 2nd. Today on HITshow, the federal shutdown is reshaping provider operations in real time. We'll walk through a checklist leaders need this week. Plus, UnitedHealth doubles down on artificial intelligence, Hackensack partners on early cancer detection, Omada Health debuts AI-powered nutrition coaching, and a new federal ask to major drug makers could reshape supply and pharmacy budgets. Let's get started. We've covered the DC shutdown 2 days in a row. Today, Teresa Vaughn is sharing a valuable action plan with health system and hospital leaders. Teresa, what tips do you have? What's new today?
Today, Steve, it's about operations. CMS has triage survey work, only immediate jeopardy and EMTALA dialysis and critical complaints continue. That changes compliance priorities overnight. Also, several Medicare telehealth flexibilities lapsed on October 1st. Therapists, occupational therapists, and speech-language pathologists are no longer eligible providers, and new in-person requirements for mental health telehealth are back in effect. Schedulers and clinics must adjust immediately. And the hospital at-home waiver expired Tuesday night. Health systems are already bringing patients back or discharging them, straining beds and staffing.
And the financial picture?
Core Medicare and Medicaid claims still pay, but safety net supports, like the $8 billion in DSH cuts and some rural add-ons, could start pinching in weeks. CFOs should model October through December. Community health centers can still draw federal funds, which buys some time. But if those drawdowns stall, expect OB and pediatrics to feel the pressure first. On the innovation side, FDA can't accept new device applications requiring fresh user fee payments, and NIH grant administration is curtailed. Academic medical centers should freeze non-essential spending tied to pending awards.
So what's the to-do list right now?
For quality and compliance, focus on immediate jeopardy and EMTALA dialysis. Next, review and update telehealth workflows for therapy and mental health scheduling and access. You'll want to reallocate staff and beds to ensure capacity where possible to cover for hospital at home being paused. With regard to finance, model your DSH and rural add-on reductions through Q4. Address the surrounding community by coordinating with FQHCs to have a path for smooth referrals. Expect device and grant delays. Adjust your timelines for innovation and research. Listeners who want the full checklist, it's posted today on HIT.show and the HIT.show LinkedIn page.
Seems like the bottom line. This isn't just politics. It's a rolling storm with real impact, week by week. Thanks, Teresa. Jade Romero is reporting that UnitedHealth Group just made a big hire in artificial intelligence. Jade, what's the move?
Steve, UHG has hired Michael Pensina, a longtime Duke University leader in biostatistics and AI, as its new chief AI scientist. Pensina previously directed Duke's AI health program, where he oversaw projects linking machine learning to real-world clinical data and outcomes. In his new role, he'll guide how AI is developed, validated, and scaled across UnitedHealth Group and Optum, from claims analytics to clinical support tools. This isn't just about tech, it's about credibility. UHG is signaling that responsible AI will be a core competency, not a side project.
So other payers and systems may follow suit?
Personally, I expect a new wave of name-brand AI leadership hires across the industry.
Thanks, Jade. Logan Stokes reports that Hackensack Meridian Health is teaming up with an unusual partner on cancer detection. Logan, tell us more.
That's right, Steve. Hackensack Meridian has partnered with Spot It Early, an Israeli startup combining canine scent detection with AI to validate a new non-invasive cancer test. The idea is that trained dogs can pick up early cancer biomarkers, and AI helps translate that signal into something scalable. For other providers, the message is clear. This is what differentiation looks like in 2025. If you want to attract patients and partnerships, participating in bold research programs, even ones that sound unconventional, can set your system apart.
Dogs and AI. Not your average clinical trial mix.
No kidding. It may sound a little rough around the edges, but for providers, it's a reminder innovation often starts where science meets creativity.
Dogs and AI. Who knew that could point the way forward for providers? Research collaborations aren't just about prestige, they can be a serious competitive advantage. Thanks, Logan. And speaking of leading the pack, let's take a quick break for a word from the Health 2025 conference, where the biggest names in healthcare gather to sniff out the future of innovation.
HITshow is made possible by Health 2025, October 26th through 29th in Las Vegas. Health is the healthcare industry's premier event, bringing together CEOs, innovators, investors, and policymakers to shape what's next. Join thousands of leaders exploring AI, care delivery, financing, and consumer health, all in one dynamic, immersive experience. With world-class speakers, curated networking, and the hottest startups, Health 2025 is where the future of healthcare happens first. Register now at HLTH.com, and we'll see you in Las Vegas.
Welcome back to HITshow. We've talked about the shutdown and early cancer detection. Now let's turn to how digital health companies are rethinking patient engagement, starting with Omada Health's new AI nutrition tool. Nate Collier brings us a story that puts nutrition, chronic care, and AI in the spotlight. Nate, what's Omada launching?
Omada Health has introduced Meal Map, an AI tool that scores meals based on nutrient density, not calories. It gives real-time feedback, weekly reports, and recipe suggestions for patients in cardiometabolic programs. In a pilot with about 1,000 members, Omada saw higher engagement compared to calorie counting. It's also a way to strengthen outcomes in value-based care contracts, especially with GLP-1 medications reshaping weight management.
So it's about deepening patient stickiness?
Exactly. Expect more digital platforms and health systems to build AI nutrition into chronic care pathways.
Our final story, Peter Betterworth is reporting on the federal government making a new kind of ask from Big Pharma. Hey Pete, what's happening?
Well, Steve, the administration has requested that Eli Lilly boost insulin production and that Pfizer increase output of Ibrance and Lipitor. The move comes amid affordability concerns and drug supply questions. For providers, this has direct implications. If supply ramps up, hospitals may need to renegotiate contracts and plan for formulary shifts. If it doesn't, clinicians could face shortages or substitutions. What's new here is the government shifting from oversight to direct activation, calling on manufacturers to respond before midterm pressures.
So providers need to keep pharmacy teams plugged in.
Absolutely. Now's the time to double-check inventory, coordinate with group purchasing, and prepare contingency plans.
Thanks, Pete. A quick reminder before we go. For a copy of Teresa Vaughn's provider checklist and more, visit HIT.show or the HIT.show LinkedIn page. That's all the time we have for today. Thank you for joining us on HITshow. If you like these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by